My baby won't sleep. What should I do?
Pray.
Hi, I'm Dr. Nellie Glusman.
My name is Amita D'Souza, and
I'm here to answer the most commonly
Googled questions about newborns.
Why is my baby's poop green is one of the most common questions that I get, and it could be really scary for new parents. Baby's poop turns from black when they're first born, and that's called meconium, to green, which is transitional stool, to yellow.
The answer has to do with how the milk or formula is transitory through the gut, but know that green poop is totally normal, as is almost every other color besides red, dark black, or white. So don't worry.
When does the umbilical cord fall off? It can range. 1 to 2 weeks is the most common, but up to 3 or even 4 weeks can happen. Back in the day, pediatricians used to tell new parents to clean the umbilical cord with rubbing alcohol. That is no longer necessary. It'll fall off on its own. My baby won't sleep. What should I do?
Pray.
The best advice I can say is sometimes keeping a low level of sound or increasing the amount of movement, so attaching the baby to you just like the baby was in the womb, sometimes there's nothing you can do, which is very frustrating. Colic is one of the most difficult things that new parents sometimes go through.
Colic is the fussy baby that will not stop crying no matter what you do, and know that it is normal. It can last up to 4 months of age, and there's not much that you can do besides sushing your baby, swaying your baby, swaddling them.
Increase the level of white noise. When babies are in the womb, they're used to constant noise, so sometimes increasing the noise could be really helpful. For example, running the vacuum, sitting in a room with a washing machine running, singing to your baby, talking to your baby, eye contact, engaging. Try a few different things out.
Cradle Cap is a rash that comes on the scalp. The most commonly recommended thing to do is to put olive oil on your baby, but I found with my daughter that just made her smell like the food I eat. So I actually use coconut oil, and you can put that on for about 5 minutes before bath time and use a soft bristle toothbrush and just scrape up the little flakes. And it most often causes a lot of anxiety for the parents, but really doesn't bother the baby at all. The most common thing you'll hear is caffeine. You should not have that. You obviously should not smoke, and alcohol, but in reality, you can have at least 1 cup of coffee a day, and I certainly did that when I was feeding my daughter because you need to get through your day. In terms of alcohol, you could have a glass of wine or 1 beer right after breastfeeding, and then wait 2 to 3 hours while that's being digested in your body before you were to breastfeed again.
Also, if you're breastfeeding, be very mindful of the medications you're taking. A lot of prescribed medications, but also medications that are found over the counter can interfere with breastfeeding and even get passed through breast milk to your baby. How do you bathe a newborn? In the first few weeks of life, a baby does not need a bath. Just a sponge bath or taking a clean, warm washcloth and dabbing it with water is usually sufficient, except for the diaper area, which you want to keep clean. A baby doesn't need to be bathed frequently because the skin is the biggest organ that we have, and it needs to learn to produce its own protective natural oils.
Do newborns sweat? The answer is yes, all people sweat. It's normal, don't worry.
Do newborns dream? Newborns do experience rapid eye movement sleep. Newborns do dream even as early as the first day of life, but the dreams are usually of the memories of the baby inside the womb.
So newborns can see right away, but their vision is limited, both in color versus black and white, and also the distance. So typically newborns can see the distance of you from the space that you're holding them to your face. So you're talking about less than a foot, which is why we tell parents to make sure you're making really good eye contact while you're feeding your babies.
Can newborns recognize their mother's smell? Their mother's smell is one of the most prevalent things that a baby or a newborn can recognize. Also, a newborn is able to recognize the smell of foods that a mother ate when the baby was inside the womb if she had a great affinity for that food.
It's also a tip for new parents is if your child is up and crying and fussy, just taking your shirt that you've worn all day and putting it next to the baby can also help calm them down. Newborns should be fed on demand is ideal, so at least every 2 to 3 hours.
After that, the baby's going to tell you how often he or she needs to eat.
Your newborn should be sleeping in a crib by themselves with nothing else in it. I know you're getting lots of cute teddy bears and stuffed animals and blankets, but they should just be swaddled and sleeping in a crib by themselves. They should be in their own separate space.
It's not absolutely necessary to do it. In fact, many different cultures from around the world do it very, very differently. You should just find a way that your baby is going to enjoy the most.
The best way to do that is the same way that you would swaddle a burrito. So you're just going to put your blanket in the shape of a triangle. You're going to fold one half over and tuck it in between their arm, and then fold the bottom up and then fold the other half over. And if you've never folded a burrito that way too, I would highly recommend it. It's the best way to keep all of your food in.
The best advice I could give you is, if you're really worried about your baby, call your pediatrician, call your doctor. Other things to look for are fever. If the baby's not able to keep themselves hydrated, baby's not peeing enough, crying without tears.
Your baby should be gaining weight, they should be peeing and pooping normally, and if you have any concerns about a rash or anything else that's going on, bring them in.
Having a newborn comes with so many questions, and it's natural and even easy to search for these questions online.
It may not always be best to consult Dr. Google. Every child and every family is different, so if you have any questions or concerns, please feel free to reach out to your pediatrician. We are here to help you.